everyone, I'm Dr. Shrestha. I'm a certified dermatologist, hair transplant surgeon and an esthetician. Today we'll be talking about how to treat acne. Before going to treatment, let's first understand what happens in acne. In people with oily skin, the oil gets trapped inside the skin layers. That leads to blackheads and whiteheads. When these blackheads and whiteheads get infected with a bacteria named P. acne, it leads to inflammation and redness. And in some people, these inflamed lesions turn into cystic acne, leaving big bumps. And this entire process is exaggerated in some individuals who have hormonal disbalance, like those with PCOS, and it is also more in those people who have excessive sweating, and in people who go to gym and don't wash their faces as soon as finishing their exercises. So it's equally important to wash your faces. There are few do's and don'ts in acne. Always use cleansers. Those cleansers containing salicylic acid and glycolic acid are important in removing blackheads that are the origin of acne. And always remove your makeup with makeup remover as soon as you reach home. Always use moisturizers. These moisturizers are very important in acne because most of the products that are available for acne treatment are drying agents, and when you do not use moisturizer, because of the drying effect, there will be compensatory oil production leading to more acne. That's why it's very important to use moisturizers. And whenever you look for products for makeup as well as for skincare, do look for a word called non comedogenic. Non comedogenic means those products that do not lead to comedones or blackheads. Hence, it is very important to look for these things. Do not squeeze or pop your pimples. Popping your pimples can lead to pigmentation and scarring. Do not eat high carb or high sugar containing diet. These are proven to increase acne. Certain foods like whey protein, dairy and dark chocolates have also been proven to increase acne. So please do avoid these kind of foods if you have active acne. And do not use dirty towels again and again, as it can lead to increased bacterial infection. Do not scrub or do facials on your active acne. And please do not use heavy makeup on a daily basis. Now going to treatment. Retinol. Retinol is a synthetic form of vitamin A that can be used all over the face, and it's the best form of treatment as long as your skin tolerates it. It can be used for blackheads, it helps in improving bacteria, it helps in improving your skin texture as well as acne scars in the long run. It is also helpful in improving the pores in people with extremely oily skin. Initially, it should be started as once or twice daily, and according to how your skin reacts to it, you can later on continue it daily. What it is said is that retinol starts improving acne after second month of therapy, and for complete improvement, it might take as long as 10 to 11 months. Benzoyl peroxide. Benzoyl peroxide is the most underrated acne treatment because it has multiple purposes. It can be used to unclog the pores, it can be used to kill bacteria as well as reduce redness. It can be used all over the face or as a spot treatment according to your skin needs. However, you should be careful because it can also lead to skin irritation. Therefore, it is important that you visit a dermatologist before applying it for the first time. Clindamycin cream or gel. It is an antibacterial agent that can be used as a spot therapy, but it should not be used all over the face, and you should not use clindamycin for prolonged periods of time without dermatologist consultation because it can lead to something called bacterial resistance. Penta pill pads. In patients with very oily skin, you can use Penta pill pads that are quite popular these days. These pads contain salicylic acid, glycolic acid that help in controlling your oil activity. However, you should only use these pads once or twice a week depending on the oil activity of your skin. Besides these over-the-counter topical formulations, there are some medical treatments that can give you permanent relief. However, you should visit a dermatologist before starting these kind of treatments. Finally, there are some clinic-based procedures such as chemical peels and hydrofacials which can give you immediate relief. Some chemical peels that contain salicylic acid, glycolic acid in higher amount can improve your acne immediately. If you have to go to a party or if you want some dramatic change in your skin, do visit a dermatologist for these procedures. If you liked the video, do like, comment and subscribe below, and do follow me in Instagram at Dr. Shrestha.